Hello, this is Dr. Trivedi, a doctor working here in this clinic. May I confirm that you are John F. Kennedy, 48 years old?
Yes, Doctor, I am.
Yes. How may I address you?
Please call me John.
Okay, Mr. John. Today we are going to discuss about your health issues. Is that all right?
Okay, Doctor.
Okay. And can you please tell me, Mr. John, more about your health problems?
Doctor, for last couple of months, I noticed that I am becoming easily fatigued and tired. This wasn't this wasn't happened before, and also I found that I cannot do any my job properly because after initiating a job, I feel that I become very much weak, very much tired, and so I have to take rest.
Okay. And can you please specify what do you mean by this tiredness?
Just lack of energy, doctor. I don't
Lack of energy.
feel that I am getting fully energetic.
Okay. Did it just start 2 months back, or did you have it before also?
About 3 months back, it
Okay.
started gradually and it is progressing.
It's progressive. Okay. And okay, have you noticed any variation during the day or any
No,
variation?
it is present all the time.
It's present all the time. Okay. And well, okay. Have you noticed any changes in your weight recently?
I think I have lost a few kg weights, doctor.
Okay. And any weather preferences?
No,
Any racing and pacing of your heart?
no.
Okay. And may I know that um, have you noticed anything that makes you feel more bad or more tired?
Any exercise or any works that make me feel worse.
Any exercise. Okay. Have you ever noticed that you have got paler or something like that?
Rather, doctor, I have got some dark skin. Not
Dark. Okay. Okay. May I know for how long have you been experiencing this dark skin?
for about 3 or 4 months after coming back from a trip to the Spain.
Okay. Okay. And can you please tell me which parts of your body are involved or whole body this dark skin?
No, I think it is more over my face and more over my arms, especially over my exposed area.
Okay. And have you noticed any soreness in your mouth recently?
No,
Okay. Do you feel more tired while standing up from sitting position? Have you noticed anything like that?
I feel, doctor, I feel that I am being somewhat dizzy, that I am going to fall down. Sometimes I feel
Okay.
that.
Yeah, yeah, yeah. I'm sorry to know. And have you ever lost your consciousness or have you fallen
No,
down
no, no,
any
no,
time?
no.
Okay. And may I know that may I know about your water work? How about it?
I think it is normal.
Okay. Any changes in color or amount or
No,
frequency? Okay. And how about your bowel movement?
it's
May I
okay.
know? Okay. And any problem, any alteration of your bowel movement or any
No,
blood evidence? Okay.
no,
And okay. May I ask you some other questions now? Do you have any chest pain?
no,
Any cough?
no,
Okay. Have you ever coughed up blood? Can you experience any?
no.
Okay. And may I know that you told that you had gone to Spain some days back. Uh, may I please know that, although it's a personal question, that may I please know that where did you stay in Spain or where did you go in Spain?
It was a five-star hotel, doctor. I went on a business trip.
Well, at this point, I would like to ask you some personal questions. Will that be okay? Actually,
Okay, doctor.
yes, okay. And do you smoke?
Occasionally.
Okay. For how long? How many sticks for how long?
About 4 or 5 sticks per day, about 20 years.
Yes, okay. And actually, smoking is very injurious for health. And I would like you to stop smoking. If you like, I can refer you to the smoking station clinic. Will that be all right?
Okay.
Okay. And do you drink alcohol?
No.
Okay. And may I know that actually it's a very personal question, but may I know that you told that you went to Spain, but during this time, did you take any recreational medication or something like that?
No.
That's very good. I'm very, very sorry to ask. And may I know about that? Do you have anybody in your family with say some type of similar types of diseases or illnesses?
No.
Okay. And any problems with the thyroid or anything like that?
No.
Okay. Do you yourself have any other health issues?
Yes, doctor. I have diabetes for last 20 years, and I need to take insulin for that.
Okay. Do you know about your last diabetes control HbA1c? I think you know about the term.
Yes, doctor. That is my doctor did it about a week ago. That was about 4.5. That was quite below the normal level. And also
Okay.
previously I noticed some unusual feeling, that is doctor called hypoglycemic attack due to the same dose of insulin. I needed to cut down my insulin dose during the last 3 months. Even before that, I took about 20 units in the morning, and now I am taking only 10 units.
Only 10 units. Okay. And may I please know that for how long have you been taking insulin?
For the 20 years.
Okay.
For the
And
diagnosis.
you told that you have been suffering from some tiredness. Well, may I know that when you feel tired, do you ever feel any hunger or anything like sweating in
No,
your body? Okay. And any racing and pacing at that time?
no.
Okay. That's all right. And okay. And may I ask you that something more about your travel to Spain, if you allow?
Okay, doctor.
It's actually a very personal question, but um, may I ask you?
Okay.
Well, while living in Spain, did you get involved in any casual relationship with anybody?
No.
Okay, okay. I'm very, very sorry to ask that. Okay, and may I now examine you?
Okay.
Okay. May I have a look at the patient's oral cavity? Okay. Yes. So some blackish spots and knuckle area or pressure spots.
Yes, that is hyperpigmented.
Okay, and I would like to check the postural hypertension of the patient.
Okay. Sitting pressure is 100 over 60, and after standing, it is 90 over 55.
Okay, and I would like to listen to the apex of the heart, apex of the lung.
Normal.
Okay, and I would like to see the anemia.
Mildly
Please, please.
anemic.
Okay, and I would like also have to have a feel the tummy for any tummy
2
pain or
minutes
something.
remaining.
For any tummy pain.
No.
Okay, and okay, and mm, okay, and now may I know what your concern is, Mr. John?
Oh, doctor, why am I having this? Is it due to my diabetes?
Uh, okay. At this moment, actually, I would have to examine you more thoroughly, and I may also do some tests. But as long as I've taken history and examined you, as long as I have done it, I think that you might be suffering from a condition named Addison's disease. Have you ever heard of it?
No.
Okay, please don't bother about the term. It's actually there are some chemicals in your body. Sometimes these chemicals we call hormones, and sometimes these chemicals are not secreted to the amount that is needed for the body. Okay, and this is what we call the steroid hormone. Okay, and when this is secreted less, these symptoms can occur, as we have told you, and uh, at that point we call it Addison's disease. There may be some causes behind Addison's disease. We might actually at first do some blood tests to
I'm
confirm
up.
it. Okay, okay. Mhm, mhm. Okay. Will I continue or will I stop?
Stop.
Okay.
So, what is your diagnosis?
I think it's uh, Addison's disease. Most probably along with autoimmune association with type 1 diabetes.
Okay. How will you investigate him?
At first, I will have to confirm the Addison's disease by doing some blood tests like 24-hour cortisol level and also short syntactin test, which is ACTH stimulation test. And then I might go for to find out the cause behind Addison's disease by doing some Monto test, test FFT review, then also ruling out malignancy. and also doing the autoimmune markers, some other autoimmune markers for celiac disease, for diabetes, GAD antibodies, and these markers. And I will also, I think these investigations are mostly needed.
Okay, any imaging test?
Yeah, I told about the chest X-ray, and also sorry, the most important is adrenal CT or MRI.
Okay.
And if needed, sampling might also be done, but I'm not too sure about it.
Any urine test, especially urine test?
Uh,
Any specific antibody test?
yeah, antibody test is actually anti-21 alpha hydroxylase antibody, as long as I can remember.
And any special urine test?
You just I've forgotten.
Do you think urinary cortisol level can be done?
Yes, it could be done. I'm sorry.
Okay. Now, how will you manage him?
Okay. First of all, patient education and counseling. Then treatment of any complications like postural hypertension. For that, I can use stockings, and also if serious enough, I can use some medications as well, like midodrine or fluticasone, like that. And then I will have to treatment the most important part, the treatment proper of the Addison series. For that, I will have to educate and counseling the patient very well that he might have to use that steroid tablet lifelong. Okay, and I will also have to give him some bracelet, or medical alert card, so that he can everybody, the other health person, can be known about it. I will have to counseling him about it, and also I will have to counsel him that in times of illness or any other sickness, he might have to increase the dose twice, the level of normal steroid dose. Okay, and normal steroid dose,
Okay.
and
Fine. Thank you.
because hello.
Yes, yes, thank you.
Okay, okay. Mhm.
You have done well, I think. And for the history taking, I think you could have asked a little bit about thing like site. You have asked about site fatigue. First, you have asked about what he meant by fatigue, and after that, site of his fatigueness. Then you have asked onset, sudden or gradual. Is it progressing or not? And then associated symptoms for fatigue. You wanted to rule out anemia, thyroid issues, diabetes mellitus, any myasthenic condition, myasthenia gravis, or any myasthenic.
I think I excluded those.
Yes, yes, I am telling that you have tried to exclude those. And timing, you have also asked about the timing when he feels it more, and eliciting factor, aggravating factor, and also severity. You have asked all of those. Okay. And after that, at the time, you have got a clue what could be the cause that for fatigue and tiredness in short stations. I think something that anemia, then thyroid issues, then diabetes, then autoimmune condition, and then some other condition like myasthenia gravis. That are the most important
Yeah.
causes here. Okay. And also for this, his blood pressure was given. It was an autoimmune association that was given for a clue. Okay, that was
What?
fine.
Diabetes.
Yes.
Yeah, yeah.
Okay, and after that, you went for his past history. You haven't asked his drug history, what drug he is taking now.
Yeah. I didn't ask drug history. I didn't ask. I couldn't ask social history, like
Yes.
other things.
And,
Occupation. I
and
just
also,
to get
and
my.
also went for family history. That was fine, but you asked very personal questions like sexual history. I think that wasn't very important here.
Well, I have a question here
Okay,
actually,
you,
because
you thought that it is associated with HIV.
yeah, because TB, malignancy, HIV, autoimmune. I think these four have to be ruled out or not. I am not sure. I was not sure about it.
Okay, for that I think okay that was fine, but also for TB you haven't asked about any fever or night sweats.
Yes, I missed that. I for TB, I just asked about chest
Any
pain.
contact with TB patients?
Yeah. I missed that. Any contact with TB patient, any fever or night sweats, I missed that. And malignancy actually ruled out by asking all those other questions,
Yes.
like urination. or
Even
bowel
weight loss anemia.
Yeah,
Sorry,
yeah,
weight
yeah,
loss anorexia. You went for
yeah.
that.
I should have gone for weight loss anorexia. I missed that, and
Yeah.
I actually excluded other autoimmune as long as I could by celiac disease and
Yes,
Canadian.
you have asked about any oral soreness. You have asked about the
Mhm.
bowel habit and
Yeah, yeah,
hot or cold preferences.
yeah, yeah, yeah.
Yes, this was and also getting failure or not. That
Mhm.
was fine.
Yeah, yeah.
I'm going for the next stage. Okay.
Okay, Tony Apu, you do want to add any? Okay, I think you can stop the recording now, Muriel, and then I can ask. Okay. Go.
And for weakness, there are two differentials that we should also exclude, like Cushing syndrome and obstructive sleep apnea. They can also present with fatigue and
Mm,
tiredness.
mm.
Okay, going for the next case.
Okay.
Are you ready?
1 minute, please. Okay, I think I should start.
So we are starting at sharp 3.
Okay.
Okay, start.
Hello, I'm Dr. Trivedi, a doctor working here in this clinic. May I confirm that you are Logan Lerman, 28 years of age?
Yes, doctor.
Okay. Mr. Logan, today we are going to discuss about your health issue. Is that all right?
Yes, doctor.
Okay, Mr. Logan, can you please tell me what has brought you here today?
Doctor, for the last couple of months, I have noticed that I am some back pain. Actually, I am an actor, so I had to do sometimes workshops. As you know, that actor had to do sometimes some film actions. We have to do some uh, movements that is quite unusual. And for last couple of months, after getting some type of dancing, and I noticed that in the morning that I am having some back pain. Initially, I thought that it was due to the stress, but it was not relieved after taking some paracetamol tablets. Rather, it was increasing. And for last couple of days, I noticed that I even cannot wake up from the bed in the morning. That is making my life at a very difficult condition.
Yes, yes, I'm very sorry to hear. I'm very sorry to hear it. May I know that did this pain come exactly where did you feel this back pain? Which part of the back?
Yes, lower part of my back, and I think it is around my spine and sometimes around my hip bones.
Okay. Can you please tell me that do you ever feel that any buttock pain in the buttock?
No,
Okay. And okay, can you please tell me that did it come along all on a sudden, or did it come along slowly, gradually?
slowly, doctor. Initially, I didn't pay it to it, but it is increasing, and so I visited my GP
Okay. Can you please tell me that how frequently do you feel this pain now?
almost every day.
Almost every day. And do you feel that is there any does this spread the pain spread to anywhere else?
No,
Okay. And have you felt that is there anything that makes it you feel better?
sometimes taking some short, some movements, some walking, jogging that makes me somewhat better, and I think working makes me
Yeah, yeah, yeah.
feeling better.
Okay. And anything makes it worse?
Morning time that makes me work.
Okay. Is there any morning jamming present? Have you felt?
Yes, doctor, I told you. I could
Yes. For how long do you feel this morning jamming?
Sometimes more than a hour.
Okay, okay, I can get it. And may I know that do you have you noticed any redness in that part in the backpack or any
No,
swelling?
no.
Okay, and may I know that is this back pain is the first episode in your life, or have you ever felt this pain before as well?
No, not this type.
Okay, a different type of any pain did you feel previously in the back?
Some minor injury, those pain. Not like this.
Okay, minor injury. Can you please specify that? Did you ever had any bone fracture uh,
No,
previously? Okay, okay, that's all right. And okay, and may I know ask you some other questions that do you ever feel any weakness in your legs?
no,
Okay, any changes in sensation of your legs?
no.
Whatever water work.
I think it's fine.
Okay, have you ever felt that you are going less frequently to for your water work, or it's not
No,
appearing? Okay, and have you ever felt any blood coming out from your water work?
no.
Okay, and how are your bowel movements? Is that all right?
I think all right.
Okay, and any blood any times while moving your bowel, passing your bowel?
No,
Okay, may I ask you some other questions now? Do you have ever had any headache?
no,
Any raised temperature?
no,
Any loss of weight?
no.
Okay, and may I ask you that have you ever had any redness of your eyes or any pain in your eyes or any other vision
Yes,
problem?
doctor. Redness. That was a thing. A few weeks ago, I had some redness in my eyes. That went
Okay,
on its own after a week.
okay, okay. And at the time, did you feel any pain in your eyes?
No,
Okay, that's all right. And may I know that do you feel any shortness of breath?
no,
Okay, any chest pain?
no,
Any racing and pacing of your heart?
no,
Okay, and any weather preferences?
no,
Okay, and may I ask you some other questions that have you ever felt any rashes in any parts of the body?
no,
Okay, any soreness in your mouth?
no,
Okay, and any loss of consciousness or any weakness in any parts of the body?
no, no,
Okay, and have you noticed any name changes?
no,
Okay. And may I ask you some other question? Now that you told that your complaints were started actually 3 months back. At that time, did you had any history of accident or trauma?
no.
Okay. And at the time, may I know that did you had any alteration of your bowel movement, any changes in your bowel habit or any
No,
chest
I
pain?
told you that I don't have any problem with that.
Yeah, yeah. I'm just asking that before that started, did you ever had any problem?
No.
Okay, okay, that's all right. That's all right. Now, may I examine the patient?
Okay.
Okay, and at the beginning, I would like to have a look at the back of the patient, and also I would like to just fill the back, and also the just beside the back, the two beside the parts, both the parts.
Okay.
Okay. I think is there any abnormality there?
No.
Okay. Now I would like to tell the patient to move his head in all parts. Okay, laterally, ups, downs. Okay.
He can do that.
Okay. And now I would
You
like to
wish really?
okay, I would like to take my measuring tape and measure whether the chest expansion is all right or not.
All right.
Okay, now I would like to tell the patient to just get out of the bed, and then I would like to tell him to go to the side of the room, and then I would like to measure the wall to occiput distance.
Normal.
Normal. Okay, and then I would like to tell him to bend forward.
Okay, he can bend forward, but not below the knee.
Okay, and bend upwards then. Bend bend backward.
Normal.
Okay, bend laterally.
Normal.
Okay. And may I ask you another question that do you have any pain while walking in the hill?
No.
Okay. And may I ask you some other questions now that do you have any history in the family of similar type of diseases?
No.
Okay. Any previous history of yourself?
No.
Have you been on any other medication?
No.
Do you have? May I ask that you are clear? I think you told me. Am I right?
Yes.
Do you take any performance enhancing medication?
No.
Okay. May I ask you some personal questions now? Do you smoke?
No.
Okay. Do you drink alcohol?
No.
May I ask you another personal question if you allow?
Okay.
Do you take any recreational medication?
No.
Okay. Do you take any medication? Okay. And may I know? Okay. May I know? Are you well supported socially and economically?
Yes, doctor. I think I am.
Okay. Yeah, yeah. And have you ever had any fall?
No.
Okay. And may I know what your concern is?
Why I am having this? And I told you that I am an actor, and it is hampering my job.
Okay,
Can
okay.
you give me a solution?
Yeah. I can get it. As long as I've taken history from you and examined you, I think that you are suffering from a condition named uh, ankylosing spondylitis. Okay. Have you ever heard of it?
No.
Okay, please don't get bothered about the term. Actually, it's a condition when there is some inflammation of your bones. Okay, some inflammation of your bones, and this can cause this type of symptoms. Okay, at first, actually, I will have to confirm it by doing some blood tests and also some scanning tests of your back and some other parts. And at the same time, I will have to involve the physiotherapist, the rheumatologist. Also, actually, the physiotherapist, the exercise doctor, and also the bone doctor. Okay, so that they can map out a plan to help you more and more in this case. And I will, if you feel any problem in your professional life, I can also involve the occupational health services. And I will also provide you some leaflets so that you can feel better and you know better about your condition. Is that all right with you?
Time up.
Okay. Is that all right?
Stop.
Okay. Okay.
So what is your positive finding?
Okay. My positive finding at first it goes in favor of arthritis. And along with that, I think he had acute enterobacteritis, which was manifested
On
by.
on examination, what did you find?
Oh, sorry. On examination, I found actually, uh, I actually found just only he had some problems on his forward bending. I think.
Okay. So what is your diagnosis?
Well, I think the diagnosis would go in favor of inflammatory arthritis, doctor. Most likely ankylosing spondylitis.
Okay. How will you investigate him?
I think I will. At first, I will have to go for some baseline tests like complete blood count to see whether there is any infection present or not. Along with that, I will have to go for inflammatory markers like ESR and CRP. Then I will go for some specific blood tests like HLA-B27. And before that, I would like to go for some plain X-ray of PA view. Sorry, AP view of his back, lumbosacral spine, and also I would like to do MRI of his lumbosacral spine as well. Uh, I think these tests will be important, and I would also go for any complications. For that, I might also go for a chest X-ray peer view ECG. Okay, and if needed to exclude amyloidosis or IgA nephropathy, I might also do urine RME and serum creatine.
Okay. Was the MRI for sacroiliac joint or lumbosacral
Oh,
spine?
sorry, sacroiliac joint. Sorry, sacroiliac joint.
Okay. How will you manage him?
Okay, at the beginning, I think the most important management will be patient education and counseling, and then forming a multidisciplinary team involving physiotherapist, occupational health services, rheumatologist, and rheumatologist. And uh, besides physiotherapy, I might go for specific medication like NSAID, and for if peripheral joint involvement is present, although I think it's unlikely here, uh, we might go for some DMARDs, and uh, I think uh, or we might also think of some anti-TNF TNF alpha medications as well. Although we have to take uh, expert opinion from pneumologists for that. I think.
Okay. So what are the differentials do you have for this gentleman?
Uh,
Differential diagnosis? Do you have any?
I think my main differential diagnosis will be inflammatory arthritis. Okay, inflammatory spondyloarthropathy, most likely ankylosing spondylitis, and other disease maybe other uh, seronegative arthritis, I think, like psoriatic Reuters or reactive arthritis. Sorry, Reuters or IBD associated arthritis, I think.
Okay. Fine. Thank you.
Okay. So please discuss more. I think I don't know whether how have I done.
Okay. This was fine, but you took a long time for history taking. You should have been diagnosed within 1.5 minutes. talking to the patient. Site, onset, right, character of this pain. You haven't asked that.
Yeah, I just missed the character. That was
Radiation and also severity. This was severe in the sense that it is affecting his job. And
yes. I missed that 2 point actually. Socrates, among Socrates, I
okay.
get it.
And after that, you could have gone to the diagnosis. Then after that, within a short period of time, you could go for the.
Yes, well, may I ask you one thing that once I can understand that it is inflammatory, okay, specifically inflammatory back pain. So I think can I just directly go to those questions specific to rule out other inflammatory, seronegative inflammatory arthritis? Is
Yes,
that okay?
it is for station 5. It is station 5. You shouldn't lost so much time.
Okay, okay, okay. And I think back pain usually gets clearer within 2 to 3 minutes. Am I right? Uh,
Yes. And after that, you should go for the to rule out other cause to establish the diagnosis, rule out other causes, and rule out any emergency present or not.
okay, okay. Okay.
You went
Yeah.
on the examination at a very late stage after 8 minutes, after 6 minutes, and that I allowed some time so you could finish it. Otherwise, you couldn't finish it.
Yes, yes, I could get it. I could get it because I thought that 8 minutes. I think I was getting that it was a bit overtimed. I could understand that time was up. I think. Okay.
and
And any other discussion?
and young age with mechanical pain or inflammatory back pain. And
Yeah, yeah,
you have been
that's more
diagnosed.
common.
You have already excluded within on minute that
Yeah,
there is
yeah.
any
But
morning.
family history might be important also. I think,
Yes,
and
family history, drug history. You have went for that. That was fine.
yeah, yeah. I think that in case of station five, I think the history part can be shortened a lot. But I think
Yes,
these questions must be asked, like that history part in station two also, like family history, drug history, personal history, and job.
yes,
All those these are common. I think. I have found out that I cannot miss these parts. These have to be asked whether it's station two or five. So actually, the main history part that can be shortened. I think. Am I right?
yes.
Yes. Okay. And any other thing you would like to add?
Driving, you should have asked for that.
In this patient driving is important.
Yes, yes. Present examining, present
So,
examining, and also have a history of iritis.
sorry.
If
Yeah.
there is any visual problem or is present or not, you should have
Mm-hmm.
ruled out that, and after that,
Mm-hmm.
and also back pain that may affect his driving.
Yeah, yeah. Okay, okay. And
Yes,
any other thing?
restricted movement.
Okay. Any
Yeah,
other thing?
other was fine.
Okay,
And
okay.
you
So
haven't went for the pulse and in a nail examination. I think you should have gone for that.
sorry. What examination?
Nail examination, pulse.
Oh, sorry. Yeah, nail examination should have been done. Why pulse? Oh, for aortic regurgitation. Sorry, I just couldn't remember. Actually, in this case, examination should be started at a very early time. Otherwise,
Yes.
it's very impossible.
After that or during the examination, you could have asked the question.
Yeah. That's correct. Okay. So I think you can stop recording for this case now.